Scabies, measles, rickets, scurvy. You may wonder why I'm giving you the names of diseases. These are all 19th century diseases. They were rampant back then, but soon science progressed, medicines became widely available, vaccines were invented, they offered protection, so these diseases receded. We rarely see them now, but in the UK they're making a comeback. Why is that? Why are diseases from the Victorian era plaguing UK citizens? Our next report has the answer.
Scabies. It's a disease humankind has known forever. Aristotle talked about it, Arab physicians mentioned it. In the Victorian period, it was infectious. Scabies is transmitted by tiny mites. They lay eggs under the skin. It causes an itchy rash. Usually, it spreads by close contact. It's associated with overcrowding or poor hygiene. It was thought to be a disease of the past. Modern medicine made it rare, but it's making a comeback in the UK. The UK is witnessing 3 scabies cases per 100,000 people. That's double the average. In some areas, they're almost as high as 6 cases per 100,000 people. There's an outbreak in care homes, in nursing homes, and in university accommodation. It's a public health crisis, and it's not the only one. In 2022, 423 people were admitted to various hospitals in the UK for rickets. It's a disease caused by vitamin D deficiency, even a lack of calcium. 188 people were admitted for scurvy, another disease caused by malnutrition. Measles cases are also on the rise. In 2023, the UK witnessed over 1,600 measles cases, a sharp rise from 360 cases in 2021. So what explains this trend? Why are 19th century diseases making a comeback? Experts cite 3 main reasons. 1 is vaccine hesitancy, 2 a cost of living crisis, and 3 cuts to public health spending. So let's look at the first one, vaccine hesitancy. Take measles, for example. It's a highly contagious disease. In 1968, the UK introduced measles vaccination. In 1996, they introduced the current 2-dose MMR vaccine. It's very effective. After both doses, 99% people are protected against measles. But people are still getting the disease. Why? It's because vaccination rates are falling. It was affected during the pandemic. Since the focus was on COVID-19 vaccines, others were neglected. And vaccine hesitancy only makes the problem worse. In 2018, 93% people thought vaccines were important for children. Today, the number is at 72%. People are simply not taking it or not showing up for the second dose. Then there's the cost of living crisis. Poverty and disease are often related. In the UK, 14.4 million people are living in poverty. 6 million of them are in deep poverty. It's a number that's fast rising. These people can't afford food. They can't afford proper nutrition, which explains the rise in diseases like scurvy and rickets. And finally, there are cuts to public health spending. The UK does not have enough health workers. These are people who can set up mobile vaccination centres. Then there's also a lack of health visitors. These are people who work with new babies. They consult with the family from when the baby is born to the age of 5. This includes individual support, vaccination advice, assessing needs and growth of babies. The number of health visitors in the UK has fallen by 40% since 2015. So there's not enough help, which explains the growing crisis. Children are missing out on vaccines, adults are not getting enough nutrition, and infectious diseases are on the rise. If the UK doesn't deal with this soon, it would be like stepping back in time for the country. And that is not a pretty picture.
From impeachments to inaugurations, if it's a political story, we are on the scene. The race for the White House is heating up.
We're beating Biden.
How dare he say that?
If it's breaking news, we're live with the latest coverage. From the White House, the State Department, and Capitol Hill, we know the issues, but above all, we know the players to bring you the latest in-depth analysis on all the key stories that we're covering. I'm Eric Ham. Join me from Washington here on Firstpost America.